Anencephaly. Anencephaly is a serious birth condition in which a baby is born without parts of the brain and skull. It is a type of neural tube defect, which means as the neural tube forms and closes, the upper tube helps develop the brain and skull, the backbone, and the spinal cord. Anencephaly occurs when the upper part of the tube does not close correctly. As a result, the baby is born with only part of the brain and skull. Anencephaly occurs in every 3 out of 10,000 pregnancies every year, or 1,206 babies every year just in the United States. Although most causes of anencephaly are unknown, some risk factors increase the chances for an infant to be born with it. According to the CDC, some risk factors are low intakes of folic acid before and during pregnancy, and Hispanic mothers have a greater chance at having children with anencephaly, but researchers do not know why. Girls are also more likely to be born with anencephaly than boys. Doctors usually say that children who were born with anencephaly will not be able to hear, see, or feel pain, but some families have had different experiences. Some children are able to swallow, eat, cry, hear, and react to touch.
Hi, baby.
Hi, Jackson. Say hi, Germany. Can you say hi to the kids that drew you pictures? Who's smiling?
Yeah, you just said hello to Mommy.
And say hi to Germany. Thank you for all my pictures.
There is only one known baby who has lived longer than a few days after birth with anencephaly. Baby Angela was born on March 23rd at 6 pounds and 3 ounces. Angela's mother Sonia learned her unborn child had anencephaly during pregnancy through an ultrasound. Doctors told Sonia that the only reason Angela was still living was because she was connected to her, but Sonia could not understand this because she could still feel the baby kicking. Doctors suggested that she get an abortion, but Sonia still had faith in Angela. Angela was born at 40 weeks, and Sonia was expecting to have to say hello and goodbye to her child on the same day, but she survived an entire day. Angela is now 2 years old and is happy and healthy. Angela is never promised tomorrow, so they are living every day to the fullest. Anencephaly sometimes cannot be detected before birth, but is immediately seen after. There are tests pregnant mothers can get to help detect if their child would have it if they have a high risk factor. Prenatal tests can be any of the following: blood tests that would show high levels of alpha-fetoprotein, ultrasounds which would show abnormalities in amniocentesis, which is when a small amount of amniotic fluid is taken out through a large needle piercing the amniotic sac. The fluid would be tested for alpha-fetoprotein as well. There are no known treatments for babies affected by anencephaly. Most infants born die very shortly after birth. Some babies live up to 6 to 12 months after birth with the disorder. Most hospitals around the country offer prenatal hospice for the parents because there's no detected place for the babies. It is just support for the family. 23% of babies live for 1 day or more, 7% die with a prenatal death, 20% die during delivery, and 50% live for just a few minutes to a day. Anencephaly usually does not run in families, but if a mother has a child with anencephaly, the percentage increases that it can happen again. The organization March of Dimes works to improve the health of babies by preventing birth defects and infant mortality through programs of research, community services, education, and advocacy. Research supported by the National Institute of Neurological Disorders and Strokes includes studies to understand how the brain and nervous system normally develop. These studies contribute to a greater understanding of neural tube disorders such as anencephaly and open promising new avenues to treat and prevent neurological birth defects.